Hi there, it's Tammy here, and in this short video we're going to look at the huge changes in the methodologies surrounding pregnancy and childbirth that have happened over time. We're also going to look at what you could be missing by following the generic, free, online pregnancy exercise workouts that seem to be the current status quo when it comes to exercise during pregnancy these days. And when you look back at methodologies surrounding pregnancy and childbirth, they have certainly changed over time. I mean, some methodologies that they used to use seem positively archaic and downright dangerous now, which actually makes me wonder, what will they be looking back on in our century, in our time, and realize that there were better, safer ways of doing things? And like I said, we're going to travel way back in time to see what you could have been eating, drinking, or doing during pregnancy had you been born in a different century. And we're going to start in the 4th century. See, I told you way back in time. Now, in the 4th century, pregnant women were actually given fragrant white wine to drink and told to drink in moderation. If you had heartburn, this was cured by drinking small sips of warm water, taking leisurely walks, and putting soft wool on your abdomen. The 6th century saw pregnancy begin with a caveat against mental disturbances and overactivity. The recommendations were around trips in a sedan chair. Yes, these were a thing, as well as short, gentle walks, massage, and wool spinning. These limitations were extended to loss of blood and vigorous enemas because, you know, who doesn't love a spot of bloodletting and a vigorous enema to end the day? Actually imagine, what would you do if you went into your obstetrician's office today and they were like, okie dokie, we're going to do a spot of bloodletting today and we're going to finish with a vigorous enema. Sorry, I can't even, honestly, I can't help but laugh at that, honestly. But we're going to get serious for a second here because during the 10th century, women were actually encouraged to eat a modest amount, only 2 to 3 times a day. And again, their meals included fragrant, slightly diluted wine. Although I'm pretty sure most of you wine lovers out there would totally enjoy this. But the reality is modern medicine has just come too far to ignore the fact that alcohol does cross your bloodstream to the baby, and it's not very good for their development. Let's just be real. Now, during the 12th century, there were warnings not to mention anything in front of a pregnant woman which she can't have, because apparently unfulfilled desires may lead to abortion. Imagine that in this day. Now, in the 15th century, pregnant women were told to give birth to healthy, warm, and dry-tempered males. They should consume warm and dry foods, and that the warmth and dryness of certain foods will cancel out a woman's inferior qualities and shape the baby into a healthy, robust male child. I mean, seriously, cancel out a woman's inferior qualities? I'm sorry, but the feminist in me can barely even bring to myself to say those words. Imagine what it would have been like living back then as a woman. I mean, heaven help me. They were also told to beware of using cold water as it's not good for the baby and it causes a generation of girls. I mean, heaven forbid. I mean, that century just kills me. So let's move on and look at the 16th and 17th century. So during this medieval period, men believed, of course, that a woman's purpose in life was to get pregnant and have babies. God, kill me now. The pain associated with labor and childbirth was thought to be due from Eve's fall from grace in the Garden of Eden, and that her original sin meant that all women were meant to suffer great pain. Again, just kill me now, please. Now, the mother's rooms would be closed off and tapestries hung over the windows to block out a lot of the light from the outside world, as it was believed that too much light could damage the expectant mother's eyes. The room would also have to be hung with calming tapestries, and images were not allowed to upset the mother, which in turn could harm the unborn baby. They also used to prescribe to the practice of bleeding women if they were having a difficult birth. Oh God, this just kills me, sorry. And that during pregnancy, a woman must ensure that her home is not, for some unknown reason, infected with frogs. Like, honestly, sorry, this is just too funny. In staying with the 16th and 17th century, it was actually recommended that babies were bathed at least once a day, and sometimes as often as 3 or 4 times a day. I mean, nowadays they only recommend that you bathe your baby maybe 2 to 3 times a week. I'm not sure quite why that was like that, but anyway. Considering that they also believed that male children always lay on the right side of the womb and girls on the left, and that if you wanted to be certain of what kind of sex your baby was, to cast a drop of milk in a basin of water. If the milk drop sinks to the bottom intact, it's a girl. If it spreads and disperses on the surface, it's a boy. So we can't really be going with what they were saying back then, can we? Now, in the 1700s, it was also believed that a man's right testicle and a woman's right ovary were responsible for making boy babies. So much so that some people actually had their left testicle or left ovary removed. I mean, can you actually imagine the type of surgery that would have been back in the day? It just blows my brain. Now, the 18th century saw some leaps in how pregnant women were treated. However, it was actually, let's just be real here, it was really archaic at the same time. Now, in 1840, the link between albumin in the urine and preeclampsia was discovered, and ether was also used as an anesthetic. In 1853, chloroform was used in childbirth. In 1867, antisepsis was first introduced, but ignored. In 1911, the link between blood pressure and toxemia was found, and blood pressure monitoring started to begin, right? In 1934, maternal mortality rates finally started their permanent decline. Now, in the 1800s, childbirth was still seen as something that women were meant to suffer through as the price to pay for Eve's original sin, right? Anyway, most women gave birth at home during the 1800s, usually with the help of their family, friends, and doctors were actually the last resort if there was a concern that maybe the mother might die. But the thing is that back then, the doctors actually brought more risks than actual help because of the danger from infection, because doctors back then, they didn't really believe in hand washing. I mean, that concept was only really introduced in the 1840s. So you can imagine the kind of infections that they were bringing to childbirth. And there was very little, if any, prenatal care. I mean, women were expected to keep up with their daily chores, even field work, right? And the mortality rate was almost as high as 1 in 8 back then. And that dramatically reduced from about 18% to about 16% just from the simple routine of hand washing that was introduced back in the 1840s. I mean, back then, chloroform or ether were used as an anesthetic to deliver the baby. And I think it's important to note here that these are now considered carcinogenic, right? I mean, seriously. Towards the end of that century, hospitals actually became the preferred place to give birth, and the mortality rates did begin dropping. Now, from a nutritional standpoint, in this century, fruit was actually regarded as an unnecessary luxury, and vegetables, unless very cheap, were likely to be replaced by bread. I mean, kill me now. I'd just starve. So actually, the diet suggested for pregnant women by doctors back then was super low in fruits and vegetables, and they didn't actually see any harm in substituting fruits and vegetables or meat with bread day after day. And I'm pretty sure that they were pretty much drinking plenty of wine and ale back then, even during pregnancy. To say we've come a long way in nutritional support for the pregnant population is a total understatement. Now, the 19th century is pretty interesting because it sees such a rapid change in medical advances and how the pregnant population and the birth itself were treated. But the thing is, it became so much more of a medical event, which was now seen to by doctors in hospitals as opposed to at home with friends and family and midwives, right? And when it comes to the nutrition in the 1900s, there was actually an overarching theme that women should not overeat, as overeating was believed to cause large babies, which in turn led to difficult births. I mean, remembering back then that the infant mortality rate was still very high. And at this point, C-section deliveries weren't very common, and they were more like an extreme alternative. So the thought process back then was that if you limit the amount of food that a woman's eating, the size of the baby will be much smaller, which would make for a less difficult birth. I mean, it's understandable kind of when you look at it like that. I'm not saying that's the right way to do it, but you can see their thinking back then. Now, in the very early 1900s, it said that pregnant women were told that there was a link between prenatal nourishment, consumption, and the temperament of the baby. I mean, a really strange one was to avoid salty or sour foods because, such as pickles, right? Because these types of food might give the baby a sour disposition. Sorry. But as we progressed through the century, things got even stranger before they got better, with twilight sleep being introduced in 1910. Now, if you haven't heard of it, twilight sleep was a method which involved dosing the mother with morphine and scopolamine. And this became very, very popular because it actually put the mothers in a twilight sleep for the birth. Now, it's important to note here during this time that women actually saw twilight sleep as a way of owning their births and saw that pain-free birth was a right of theirs, right? Now, the problem is it not only caused extreme hallucinations, but it also increased the chance that the mother and the baby would actually die. I mean, morphine and scopolamine, seriously. The 1920s saw childbirth move from a more natural labor and delivery to an absolute medical event, with a large percentage of births now occurring in the hospital under the guidance of doctors who used almost every single medical procedure in childbirth that they could, pretty much, from forcibly dilating the cervix, using ether during the second stage of labor, episiotomy and forceps delivery, extracting the placenta themselves. Medications were given for the uterus to contract, and then obviously stitching up the episiotomy that may not have even been necessary in the first place. Just thinking about it makes me sugar. And of course, we can't forget twilight sleep was still popular back then. And in case you forgot, that's morphine and scopolamine. For those that don't know, scopolamine is a drug that actually puts people into a zombie-like state where they lose both their memory and free will. Far out. Morphine just so happens to be what they give to heroin addicts when they're coming down. So when you look at it from this drug cocktail, it's pretty damn scary to think that this is what women were given during labor. Seeing that we know that these specific drugs would have crossed the mother's blood supply to the baby. It's crazy. But by the 1930s, about 75% of all births happen in hospital. Despite this, the mortality rate for infants was super high. It was like 40 to 50% increase in infant deaths just from birth injuries alone. And that's from all of those unnecessary interventions. Just thinking of them makes me cringe. And of course, twilight sleep was still going strong. Thankfully, by the 50s, twilight sleep was finally starting to fall out of favor. Now, this was due to the coverage around the treatment of patients delivering under this absolutely insane cocktail of drugs. It wasn't uncommon for women who were suffering from hallucinations from these drugs to be restrained using ties around their wrists and ankles during birth. It is mind-bending stuff when you actually do the research around it, which I did a lot of for the pregnancy process program. It wasn't fun. But thankfully, Due to an obstetrician, Dr. Grantley Dick Reed, and the nursing profession, childbirth was starting to be looked at once again as a natural, normal, healthy occurrence. Medical advances like the ultrasound and findings around things like insulin's effect on the size of a baby all helped in increasing the safety of childbirth. And as we get closer to today, but still so far away, in America in 1965, approximately 30 to 40% of pregnant women smoked. I mean, this continued to the 70s, where you could even smoke in the wards next to the babies. I mean, imagine sparking up in the maternity wards nowadays. I mean, seriously, think about that. And there also wasn't any directives around alcohol consumption during pregnancy. I mean, that wouldn't start until around the 80s, right? But thank goodness, twilight sleep back in the 70s was no longer being used. And things like, techniques like relaxation, pattern breathing, hypnosis, water immersion, and the Lemaze method were introduced, to women during their birth back in the 70s, right? This also saw the introduction of epidurals and synthetic oxytocin being used in childbirth. Now, I have my own thoughts on these, but this video is not the place for them. But if you do want to hear them, feel free to join my complimentary but private community. The application link is in my bio or this video's description. But we're going to talk about the 80s now, because the 80s, as we all know, were a wild time of excess for pretty much everyone. And pregnant women were no exception at all, with smoking, drinking, and even cocaine use, with some studies showing 25% of pregnant women in the 80s were using cocaine. I mean, to be fair, it was only in this decade that women were starting to be warned about the dangers of alcohol and fetal alcohol syndrome. But still, 25% taking cocaine? Madness. Now, the 80s also saw exercise come more into focus during pregnancy, right? Previously, it was believed that exercise should be discouraged, due to a number of theories, right? And these are things like decreased uterine blood flow due to dehydration, and blood being redirected to the muscles, causing poor fetal growth. Things like increased core temperature in the first trimester, causing something called a teratogenic effect. Increased release of chemicals and hormones that could trigger preterm delivery, increased risk of injury due to relaxin and the effect that it has on the joints, right? Now, the 80s saw changes to this. However, there were quite strong restrictions on what you could and couldn't do in that specific time. There were time limits on it where you couldn't exercise for more than 15 minutes. Now, it's not far of a jump from the 80s to today, but so much has changed in the way that pregnant women are cared for, right? Almost every aspect of how a woman is cared for has changed, from, the guidelines around weight gain to alcohol to smoking to coffee and, of course, substance intake. All of these have changed. Exercise guidelines have totally changed from a place where it used to be discouraged to a place where it's now encouraged. And all this makes me wonder what we're going to be looking back on in 40 or 50 years, and wonder what on earth were we thinking when it comes to the pregnant and postnatal population. And my question is, have we caught up enough when it comes to exercise during pregnancy? Or will we be looking back wondering why women were being herded into generic one-size-fits-all workouts during their pregnancy? Or why their health and well-being wasn't being looked at in a holistic way, where the 4 core pillars of health were being addressed? And I certainly think that there's one thing that we will be wondering, and that's why so many women were being left to find all of the answers to all of the questions themselves, And it's my goal for those going through their maternal metamorphosis with the pregnancy process program that they don't actually look back in disbelief at their pregnancy years down the track and wonder what on earth are they thinking, or think to themselves or say, I wish I knew that before. So if you want to look back at your pregnancy journey, at your pregnancy exercise journey, and your health and well-being during this time, and know that you were ahead of the curve instead of being part of the herd. If you want your health and well-being looked at in a holistic way, where all 4 core pillars of health are being considered, and you're not being left to find the answers to all your questions yourself, or left wondering, I wish I'd known that before, or thinking I wish I'd known that before, then feel free to head to the link in my bio or the video's description and apply to join my complimentary but private community. So that's it from me today. I hope this video helped. I hope you enjoyed the trip back in time, and I'll see you in the next one. See you.